Hello, good afternoon. Thank you for joining us for today's network call, the sixth of the Stepping Up network calls. My name is Nastasia Walsh. I'm a program manager at the National Association of Counties, and I'm going to be facilitating today's network call. For those of you who this is your first contact with the initiative, this network call is part of Stepping Up, which is a national initiative to reduce the number of people with mental illnesses in jails. Stepping Up is the result of a partnership between the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation. And we receive generous support from the U.S. Department of Justice's Bureau of Justice Assistance and other private and corporate sponsors for the initiative. Real quick logistics, we're not going to have a ton of slides, but please feel free to expand your screen so you can see the slides clearly. You can use the questions box to type in questions at any time about the information that we're covering, or if you're experiencing any sort of technical difficulties. If you're having technical problems, we will respond privately in that questions box, so keep an eye on that. And then if it's a content-related question, when we come to that part of the network call, I'll read the question on your behalf. So that we can have those go to the speaker. So please feel free to start submitting any questions at any time during this network call. And then thank you to those of you who submitted questions during the last webinar on this topic, and those of you who emailed some questions earlier this week that you wanted to make sure were included. So please feel free to go ahead and start submitting some questions if you have ideas. Quick update on Stepping Up. I'm proud to announce that as of today, 393 counties across the country have already started to sign on to the initiative by passing a resolution or proclamation to join Stepping Up and to support their local activities to reduce the number of people with mental illnesses in jails. The most recent resolution came from Kalamazoo County, Michigan, which has about 260,000 residents. So we're very excited to have the folks from Kalamazoo County be part of the Stepping Up initiative. Stepping Up counties represent more than 130 million county residents in 43 states across the country. About 40% of the U.S. population lives in a Stepping Up county. So if you are wondering if your county is part of Stepping Up, just go ahead and check on stepuptogether.org, click on what you can do, and you can see a list of all of the counties who have joined the initiative. By state. You can also get a template resolution on that site if your county is one of those that has yet to join the initiative. And if you do pass a resolution, please be sure to send that over to us via email so that we can make sure and include you on the Stepping Up map and the list of counties, and make sure that you're getting access to all of the resources that are there for the Stepping Up counties. As you know, this year, Stepping Up launched a new series of webinars and network calls and resources to really sort of elevate the 6 questions framework of the Stepping Up initiative. This is the 6th network call of the 6 questions, and so this is sort of the culmination of the 6 questions framework. And so I would really strongly encourage folks, if this is your first network call, or maybe you've only been on 1 or 2, all of those webinars and slides are archived on the Stepping Up Toolkit, stepuptogether.org/toolkit, by clicking on those yellow bars that go to each question. So I would strongly encourage folks to go back and review the webinars and network calls for all of those 6 questions to help inform the work that you're doing, because again, we're not going to cover that today, and there's a lot of rich resources there and other counties who have been part of that. So I would strongly encourage you to go check those out. We do have a webinar coming up next month on November 9th at 2 o'clock Eastern, so the same time that we're having this today. And the webinar on November 9th is going to address housing needs of people with mental illnesses in jails. And we'll follow that up with a network call with the same speakers, sort of like we're doing today. And you can register for both of these webinars on the Stepping Up Toolkit, so stepuptogether.org/toolkit. Also, just a reminder that the next series of rural, mid-size, and large urban counties calls will be held in December. These calls are for county leaders who are part of the counties that have passed a Stepping Up resolution, and really sort of a forum for more peer-to-peer engagement from similarly sized and similarly situated counties. And so if your county has passed a resolution and you are not part of these discussions and you would like to be, please give me a call or email me and I can add you to the appropriate list, and so we can talk about that more. The hope really is that all of these opportunities are a way for you all to engage on the resources and on the discussions that you want to have about the challenges that you're having and the ways that you are seeing progress on reducing the number of people with mental illnesses in your jails. So we welcome you to join us for any and all of these resources that we have coming up. For today's network call, I want to go ahead and introduce the speakers. All of our speakers are going to be joining in the Q&A and discussion with audience members, and we encourage our audience participants to direct their questions to any of these speakers. You can pick a specific speaker or two, or sort of a general question as you go forward. From our previous webinar, we had Risa Hanneberg from the Council of State Governments Justice Center, but today we're joined by Katie Habert, who's the Deputy Program Director for the County Program at the Council of State Governments. She's filling in for Risa. Katie manages the Stepping Up initiative at the Justice Center, where she's worked for a number of years to support state and local grantee activities focused on reentry, correctional practices, substance use treatment, and co-occurring substance use and mental health disorders. Very knowledgeable about the Stepping Up initiative and what's been happening with counties. So thank you, Katie, for joining us. We're also joined by Mary Ellen Shepard and Dr. Ryan Cotter from Maricopa County, Arizona, who you heard from last week. Ms. Shepard is the Assistant County Manager for the Justice, Health, and Human Services Department in Maricopa County. She serves on the Arizona Supreme Court Task Force on Fair Justice for All and its Mental Health and Criminal Justice Systems Subcommittee, as well as the county's Criminal Justice Coordinating Council. She chairs the county's Smart Justice Committee, which is responsible for improving long-term public safety outcomes and reducing recidivism for people in the county. So we're excited to have her back. And then we also have Dr. Ryan Carter, who is the Director of Research for the Maricopa County Justice System Planning and Information Division. And this is a division that supports all major criminal justice agencies within Maricopa County and consists of graduate level researchers specializing in statistical modeling, program evaluation, machine learning, process improvement, all of the research and data things. So he's a great person to have on your team. So welcome back to all of you. And thank you, all of you, again, for being part of this discussion. I'm going to stop talking and sort of kick off the discussion here. And to do that, I really like to ask each of the speakers, one question to get their responses. And I think this will help get some of the audience participation, get some of your juices flowing on some of the questions that you have. So just to kick it off, I wondered if you could walk us through one way that using data to track your progress has had a positive impact on your efforts. Maybe it's a new program or new policy that was implemented or new funding that was awarded. We'd like to hear about how you've really been able to use these methods that you're doing to inform policy. So maybe we'll start with, I don't know, Dr. Carter or Mary Ellen, if you wanted to start.
Sure, I'll start. So an example that comes to mind, and I talked about this a little bit at the webinar, was here in Maricopa County, we wanted to answer one specific question related to pretrial detention, and that was how long can individuals remain in pretrial detention before adversely affecting their recidivism outcomes? And we replicated the only other study that's looked at this was a 2013 study by Lowenkamp called The Hidden Costs of Pretrial Detention. There were some emails. You can look up that study. It's available if you just Google it. And Lowenkamp's study found essentially that holding anyone beyond 24 hours increased their risk of recidivism. Here in Maricopa County, we replicated this study, and we found that individuals held 1, 2, or 3 days did not have any change in recidivism rates, but once you crossed 4 days, it increased the likelihood of recidivism. And so based on that data, we took that data, we presented it to the Smart Justice Committee, we presented it to the MIC Justice Committee, to the Board of Supervisors, And a program that was established because of that research was the justice courts created a video conference court where individuals were previously, when they were detained in jail, they were waiting up to 10 days to see a judge. And the video court basically allowed them to link a judge to the defendant much quicker. And I believe they have changed their average length of stay between being detained and seeing a judge from 10 days to 2 days. And so that affects a lot of individuals in our system. And so that's just one example of where we took data, we figured something out, and then a program was implemented because of the research.
This is Mary Ellen speaking. In addition to what Ryan shared relating to that hidden cost of pretrial, what that research helped inform us with respect to stepping up was we had created goals around stepping up that included reducing the average length of stay for persons with mental illness in our jails. And at that point in time, I don't remember exactly the number. I believe it was around 12 days, and our goal was effectively to try to reduce that by a day or so. Once we got Ryan's research, we realized that by just reducing the length of stay by a day or two, while it may sound as though we were having some improvement, we recognized clearly that we weren't impacting on the likelihood of recidivism. So that helped us reframe our goals. Another specific example of using data to inform policy and practice has to do with an evaluation done of individuals in our jails that I'm going to use the term extreme chronic offenders. These are individuals that were identified that had been booked into our jail 15 or more times in a 2-year period. There was nothing magic about 15 or more times. That was just really a starting point. But as a result of simply identifying those individuals, we learned a significant amount. There were 59 individuals who fell into that category, the large percentage of which were misdemeanor offenders who had been booked by the city agencies that book into our jail. 24% of this group had SMI flags, so we knew that they had a diagnosed mental illness, all of which were also homeless. The cost of this 59 was over $700,000. And those are real costs, again, because these were individuals that were booked in by cities. And the cities that book into our jail, if they're on city offenses, they're not felony offenses, the cities bear the full cost of that per diem rate in that booking charge. So the $700,000 was real dollars being spent for the most part. So with that data, what we have done is brought together the partners that have the ability to impact on the outcomes. We brought in our housing authority, who has housing set aside that can support this population. Our Human Services Department actually reallocated funding that they have available through their programming to support housing for this population. Correctional Health, who will be the central focal point for identifying the population and making the linkages, and then the Regional Behavioral Health Authority will be targeting the wraparound services. But for the data that pinpointed this population, showed the cost that this population is having on the system, and the lack of resources to change outcomes, we wouldn't be in a position to have a targeted solution, which we are in the process of finalizing all of the agreements between agencies in order to implement and affect the change. Great,
thank you both so much. And I want to ask you a question later about that data sharing agreement. But before I pass it over to Katie really fast, we just had a quick question come in for you, Ryan. If there's a place where someone could find out more information on the video court, is there a website or anything where people can get information on that?
I'm not sure, to be honest. I can follow up if someone sends an email to me, and my contact information is in a later slide. If someone emails me, I can definitely check with the justice courts and get back with them.
Okay, great. Thank you so much. Katie, you work with a lot of different counties across the country on this issue. What are sort of you seeing as some ways that folks are using this data to inform, what they're doing and where they've seen some successes?
Sure, thanks, Nastasia. I'm going to do my best to channel Risa in this discussion today. Have some kind of broader comments, and that will end in some of those examples. I think that we all recognize that utilizing your data really helps your planning team to monitor how the implementation of your plan is going, some of the impact of your efforts, informing reports for county boards, county officials, and really helping you think through where you would target additional or continued resources, and really justify maybe some additional or continued resources are needed as well. So have some examples of that at the end of my comments. I will say that, tracking progress is so closely tied to question 3 as well. Do we have baseline data? And I know that folks on the phone know it's really important to know where to target your resources and efforts, and to be able to identify if your efforts are working or not. I think success towards that can be defined in many different ways, and Stepping Up really suggests that to simplify things, you can begin by focusing on if your policies and strategies are working by focusing on the impact and tracking against the 4 key measures, reducing bookings into jail, reducing average length of stay, increasing connections to treatment, and reducing recidivism, and that this can kind of help give efforts a kind of structure and a real way to measure progress to determine if, a certain policy or practice is working. And, as folks know, we really suggest through Stepping Up that establishing that baseline count of the proportion of people with mental illnesses in your jails, so that you can then track your progress against that is really the way to see whether or not those strategies and policies are working. And if you're finding that they're not having an impact on those 4 measures, you can kind of reconsider your strategy potentially and maybe pivot from there. I think it's also worth mentioning really quickly, it can take years to see measurable results, so it's important to also monitor some of your short-term gains, such as, if you want to reduce the number of people being booked into your jail, you'd have to know the baseline number for that first. In order to know that, you'd have to really have a screen that's implemented and done for everybody at booking. And so just getting folks around the table to discuss those and identifying a validated tool, for instance, is a really great interim goal. And so I definitely want to think of the short-term wins in this larger conversation about tracking your progress. Some examples that we're seeing that touch on these things, in addition to the great ones that were presented on the webinar. And I don't know if any of these folks are on the phone, so if you are, please feel free to jump in and correct me if I misstate anything, or if you want to elaborate with some additional details. But we know that Champaign County, Illinois is proposing some different projects and recommendations to their board tied to the 4 key measures, so that they can be very clear about how they track them moving forward. So it's a little bit more about planning to use those methods and planning to use tracking to inform policy. So specifically, they're tying some of their recommendations so for instance, one of the recommendations is enhancing initial law enforcement response by establishing a co-responder or similar approach. And they've tied that in terms of measuring that to the first measure, which is reducing bookings in the jail. So I think it's really interesting to also think through tracking progress in terms of your planning process as well, and tying some of these recommendations and the results of those to these different measures. In the 6 questions, 4 measures document released through Stepping Up, there's also some examples from Johnson County about using data to fully, Johnson County, Kansas, I should say, about using data to fully fund a co-responder position after the grant funding was over. And they were able to do that by taking data to show that over the period of the grant, that repeat calls for service to the same address were estimated to have decreased by 20%. And so they were able to use some of the data to track their progress and use that to actually make the case for fully funding a position after grant funds were over. So those are just a few examples of some of the ways that we're seeing around the country using data to track progress and really have a positive impact on efforts.
Great, thank you so much, Katie. And I think, you're right. One of the points that you made is celebrating some of those interim successes and showing progress in the interim. We all want to reduce the number of people with mental illnesses in our jails, but we know that doesn't happen overnight. And so tracking progress on those 4 key measures as you move forward will really help to continue the momentum and I think keep people engaged in some of the work that you're doing and the progress that you're making. So thank you for that point. Wanted to remind folks, since we had a couple of folks on the phone who have their hand raised, digitally have their hand raised. We're not going to be calling on people on there, so if you have a question, please go ahead and type it into the questions box, and I will read it aloud for you. So I wanted to ask sort of a follow-up to one of the things that the folks from Maricopa County and Mary Ellen, you were talking about is these data sharing agreements that you're getting in place. And I know that when we talk to a lot of folks, they really face challenges with sharing information, whether it's an automatic electronic share, sharing aggregate information, or sharing information on actual individuals. Can you talk a little bit more about these data sharing agreements that you're putting together, who you're sharing them with, and how you were sort of able to negotiate those, and how you were taking into consideration HIPAA or any state privacy laws as part of these data sharing agreements? What was sort of your process for getting these together, and who are you have these sharing agreements with, and then how are you using them or planning to use them?
In part, the agreements are operational, and so we started with agreements to what services would be provided by the agencies we're partnering with. So I wanted to be clear on that. And then with respect to the data sharing, it was an understanding of what specific information the individual departments would need to have. So for example, correctional health has the healthcare information. Not all of it is necessary to be shared. So we had to determine what was important to provide to the Human Services Department. Again, because their focus is going to be around the housing piece. So all information wouldn't flow to them, simply those pieces that were relevant to the role that they would play. With respect to the Regional Behavioral Health Authority and Correctional Health, they've had data sharing in place for many, many years. They've had that direct feed. So individuals managed under the Regional Behavioral Health Authority, we know that when they're booked into the jail because there is that electronic data feed. So when HIPAA does apply, and it specifically does apply, our strategy for managing that is to have the population we're serving sign agreements for the release of data. So that's how we've managed to get around the primary hurdles. Number one, understand what data needs to be shared, understand whether or not the data is in fact HIPAA protected, or as you know, criminal history information is also protected in terms of secondary dissemination. So we needed to be aware of that. And then to the extent that there were those barriers and we still needed to share the information, getting those consent agreements put in place. And I've got Dr. Cotter here. Is there anything I'm missing that you would add to that process?
No, I don't think so. The only thing I would add, which I think everyone knows, is that data sharing is really founded on trust. And so you have to have an established trust. And I think here in Maricopa County, having both smart justice and mixed justice, where everyone is in the room, everyone agrees upon the goals that we're committing to, I think that's been really helpful in establishing the relationships that kind of lay the foundation for the data sharing agreements.
And Nastasia, if I can just jump in, I just want to reiterate what Mary Ellen and Dr. Cotter said. I think, and also note that sometimes in some states, there are actually some state laws are more prohibitive sometimes than federal laws when it comes to information sharing. But I do think one of the items that Mary Ellen mentioned in terms of really figuring out what information is relevant for which agency, and then being able to think through agreements for the release of data is so important, and something that we see in lots of places as a way to tackle some of this information sharing. So I just think it was really a great point.
Great, thank you so much. It was going to be one of my sort of follow-up questions for you all is what are some of the barriers and how are you overcoming some of these? And I think you guys kind of answered some of those. I know that this is something that folks continue to ask us questions about, and look for ways to overcome this. So I appreciate it. One of the things that folks are also interested in, we talk about, looking at those 4 key measures: the reducing bookings, reducing length of stay, improving connections to treatments, reducing recidivism. I'd be interested in, what other kind of data people are collecting and tracking, or what kind of benchmarks people are using for success. These are, sort of very criminal justice oriented, and I know that there's folks who are tracking other kind of outcomes, in addition to connections to treatment, putting folks into housing, I know is a big issue in Maricopa County, or connecting people to other services. Are there other outcome measures that folks are collecting, or benchmarks that they're using to show success with their initiatives? And I don't know, Katie, if you want to start, if there's anything that you've heard from the folks that you're working with on other sort of outcome measures, or maybe something that's a little bit less of a criminal justice side, some of the other measures there.
Sure. I mean, I'm happy to start off. I think, I think that you mentioned one in particular, which is housing. That is certainly, a measure that a lot of folks are looking for in terms of success. I would also sort of answer this by repeating some of my initial comments in terms of, maybe instead of beyond the 4 measures, which perhaps Dr. Cotter, and Mary Ellen can answer, as well as some folks on the phone, that within that, it's also really important to use those interim benchmarks that I mentioned. So, in terms of tracking those 4 measures, being able to include some of those interim measures towards success, such as, have you adopted a standard definition of serious mental illness that's applied throughout your local criminal justice and behavioral health systems? Do you have those validated mental health screens and assessments in place, as well as kind of the appropriate processes associated with implementation? So I think that also thinking through, yes, other measures beyond the 4 key measures is helpful, but also thinking through within that, what are some of the other kind of benchmarks that you can establish to show progress and kind of continue momentum towards that goal. But perhaps Mary Ellen and Dr. Cotter can discuss a little bit more about any measures they use beyond the 4 key measures that are helpful for them.
The one piece that I wanted to add to this with respect to the measures that I believe has been so critical to our work here in Maricopa County is we look at each of these measures in the context of risk. And so we have some understanding of what they really mean. I'll give you a recent example. we were looking at our data and we were tracking on average number of bookings, but then on our average length of stay, we found that we're actually trending up. And when you look at that without context, it would seem that we are not being effective in our goals. But so we understand we have to step back and say all of this work has to be in the realm of the risk needs responsivity principles, meaning that the low risk nonviolent is those who we are seeking to keep from coming in our system in the first place and getting out of our system if they do enter as quickly as possible. The moderate to high risk, we understand those individuals have both mental health needs and criminogenic needs, which both has to be addressed. So they may be, as we shift the low risk out of the system, it isn't surprising that the length of stay may actually increase because our percentage of our population remaining are those at higher risk, and which by nature means potentially additional more serious charges, but certainly greater needs that require greater intervention. So I wanted to speak to that. The other measure, and it really depends on what we're focusing on as well. So we have programs around that look in addition to housing, but we also recognize the importance of vocational employment training and services. So when we're placing people in a program designed to address that need, we're looking at certainly recidivism, but we're also looking at other critical factors like, are they getting employment? Are they staying employed? What are their wages associated with that employment? Another measure that we are looking at here in Maricopa County that is important for this population as well is how many are we enrolling in healthcare? That's been a very specific focus of our work, is identifying those who are eligible for access for our Medicaid and ensuring those populations that are eligible and not already enrolled in services that we do connect them to healthcare. So that's another measure that we are monitoring here in Maricopa County.
I don't really have anything to add, but I just for the bad sake of repeating, I think it's really important just to repeat real quickly what Marilyn said about the average length of stay, because one of the 4 key measures is, in fact, reducing average length of stay. And if you follow the R&R model, which is kind of the #1 treatment paradigm adopted in criminology at present, it says that you really should be getting low-risk offenders out of the jail system as quickly as possible and into the community, and focusing all of your treatment on moderate to high-risk individuals. And if you actually do that and you put that in place, you very, very likely might see what we're seeing, which is an increase in average length of stay, and that should not be considered an indicator of failure, because what our data is showing is that we are in fact getting people out quicker. We're getting people out in that 1 to 3 days much quicker than we were before. So that's a success, and because we're getting the low-risk people out quicker, the average length of stay is actually increasing. And so that, I think that's just worth just quickly repeating for this conversation.
Great, thank you. Yeah, that's a really good point, and I'm glad that you all brought up, looking at this data in the context of risk and the risk need responsivity principle. I think it's going to be really important. It's an important point to make. We want to be reducing length of stay, but like you said, if we're getting the folks who are sort of the lower risk folks out and better connecting people to treatment quickly, then you might see, because of the people who are remaining, a longer length of stay. So I think it's a really important point to make about sort of looking at the data in context about, you know, in terms of what you have in place and what you're putting in place to have the impact and why they're impacting that way. I think it's really important to note. And we had, I think this, you know, a little bit follows up with your questions, but we had a question about if folks are collecting data on how long it takes to connect a person with mental illness to housing and community mental health services. So their length of stay in the jail before getting services and being released. And it sounds like that is something that you all are doing in Maricopa County, is tracking that specific point on there too.
I would say we have kind of crudely been doing that, but we recognize the need for that and to better track individuals as they're being referred into the community. And so I'm going to say approximately 2 years ago, the Smart Justice Committee sponsored investigating the creation of an application, a web application, which we actually just launched yesterday. It's been finalized and launched, and it's called the Community Resource Connection Project. And what it does is it essentially is an index of all community service providers available in the community. And whenever an internal employee of Maricopa County makes a referral, that referral gets logged into the system, and then it's date stamped, and it goes into a database. And for the first time, we'll be able to much more accurately look at things like time between booking and referral. And then, so that's the first piece. The second piece, and I think this was one of the other questions, was we understood very early on that we really needed to get data on community service providers, what happens when individuals leave our system, and we have less control over that. And so this application is a method, it's a very user-friendly method where we can gather data back from the individuals in the community. So not just a timestamp of when was the individual referred to a community service provider, but then on the backside, when did the individual actually show up at the community service provider? Did they successfully complete treatment, things like that? So it's taken us a while to build this application. It's a pretty sophisticated application we built in conjunction with our researchers and our IT division. But so we've definitely recognized the need for looking at those measures of the speed into treatment and getting treatment metrics back from community service providers. And that, like I said, that application, we're very excited that application was officially launched after beta testing yesterday. So it's available to all Maricopa County employees as of yesterday.
And Ryan, correct me if I'm wrong, but one of the other real benefits of the new system is it allows us to track if the individual comes back into our system. We will be able to identify, connect that as well. Correct. To who they've been referred to and monitor that. So it's allowing us to connect the dots, so to speak, which we haven't had in place up to this point in any meaningful way, at least.
Yeah, and I'm not sure if other jurisdictions would experience this, but you can be referred here by multiple different agencies, and so this application will also track your history. So if you come into the system and CH Correctional Health Services makes a referral, and then you end up on probation, and probation decides to also make a referral, they didn't know that the referral was previously made by CHS, so now they can track that history, and the probation officer in that example could see that Correctional Health Services had made a referral 2 days earlier for housing, and so the probation officer maybe just needs to follow up rather than make a new referral.
Great. So it sounds like a really good program that you all have up and running, and we had several questions from folks about what the application is called, or if it's something that they could get, or something they can buy or purchase or download. Can you talk about sort of the process of how you got this up and running, and if there were costs associated with it, or if there's some way that other counties who are on the phone can replicate these efforts? Can you talk a little bit more about that?
Sure. So the idea was sponsored by Smart Justice. They recognized that there was a need for this application. The actual how it was built, we did have financial support from the county. The county put aside money to build the application, but when we actually started to build it, we were able to do 100% of the building in-house. So we had money if we needed to hire contractors in. We didn't actually need to use it. And so the application was built by the research division and the IT division. It is a web-based application. It's based off of Esri. It's like an add-on to the Esri GIS software. So it's an Esri type dashboard, and then it feeds into a SQL Server database, and that's kind of how we run. And then my division can pick up all the data in the MySQL or the SQL Server database and run metrics off that. So it's not, I'm not sure it's something you can buy. We kind of built it in-house. But again, if people have questions about it, they can feel free to email us, and we'll definitely get back to them.
And while it is premature, one of our discussions when we were piloting this program was how could we as a county make something like this available to other counties. So while I don't have the answer to give you today, however, I wish I did, I do want to assure you that that is a part of our conversation, and we will be working internally here in the county to see what it might take after we fully launch this and show that it's achieving the outcomes we expect, to be able to share this with other counties.
Great, that's very generous, thank you. And I'm sure folks will be interested in hitting you up for that once that option comes available, and wanted to remind folks that we will have Mary Ellen and Dr. Cotter and Katie's contact information on the next slide, so we can share that with folks who are interested. You know, just a quick follow-up question for you, Mary Ellen. You know, you work in the county manager's office. You help with figuring out things like finding money to pay for these sorts of things. How do you all, or maybe how did Ryan, or who came to you with, you know, we need some funding and some staffing to do this, and how do you sort of sell that? I know you have a lot of competing priorities for funding in such a large county. How do you sell that as something that you really need to have, especially for folks who, you know, I know we get a lot of folks on the phone who come from smaller counties or more rural counties, and it doesn't mean that they necessarily need to build one of these, but how do you sort of talk about the need for building this sort of system and sell it to folks as something that's really going to benefit your efforts?
Wow, that's quite a question. The history of this particular project, as Ryan said, it came out of our Smart Justice Committee. But one of the things that we did, and it's going to be a somewhat long answer, forgive me for that, but we brought in the National Institute of Corrections, brought in a consultant to help frame our efforts around smart justice, which is really, again, based on the R&R principles and long-term public safety. So in bringing in the consultant, and at this time when this occurred, I wasn't in my current role as assistant county manager. I was actually a deputy chief with the sheriff's office. So we brought in individuals, got all of the key stakeholders together, sat down and looked at what we needed to do as a county. A part of this process was this need to identify what resources currently existed. How did we better connect to those resources, both internally and in the community? So my point in sharing all of that is it was a part of a larger effort involving all key stakeholders. There was consensus around the need. So with that foundation, we didn't have to sell anybody on anything because they were involved in the process from the beginning, and there was concurrence from the beginning around the need. So I think that's critically important as these efforts are moved forward, is ensuring that each time you bring something forward, particularly something that has a cost to it, that it is a part of a long-term strategy. So it's not heard for the first time when you're asking for resources. The other critical piece, though, that I need to be candid about, because it is likely unique for us here in Maricopa County, or certainly not as readily available to the smaller counties, is a number of years ago, the county had set aside one-time dollars. And they set it aside for the purpose of supporting innovative criminal justice initiatives that would reduce the cost to the county. So we have dollars that we have wisely invested in piloting programs that may prevent recidivism. And these were dollars that we targeted for use for this purpose if needed. So we didn't have to go back to the board to ask for dollars. Our board had allocated monies years ago in supporting these kinds of initiatives. So if that's doable as well, it keeps the constant handout from having to happen. It's an investment up front, again, with one-time dollars, so it wasn't the reoccurring cost, but investment up front to help fund these innovative strategies, pilot new efforts, and then our obligation is to then report back to the board the impact that investment is having on reducing recidivism or getting more people engaged in services, or any number of the measures we've already talked about.
Great, thank you. I know that is, I wouldn't say a loaded question, but it is, a complicated one, and just goes to show, the amount of advanced planning that goes into this, and not just, saying, all right, we need this, and then, okay, we need this, and then we need this, like really coming up with sort of a strategic plan around it and having it be sort of a full package around it is really helpful. One person just wanted you to repeat the group that you worked with on it. I don't know if it was the National Institute of Corrections or who you worked on getting all of this started.
Yes, we reached out to the National Institute of Corrections. One of their initiatives is called Transition from Jail to Community. And that is similar to the Stepping Up initiative in terms of the approach and understanding who is coming into your system, what system players are critical to success, focused on leadership support, collaboration. And we brought a consultant in to help frame our work under that initiative, which when Stepping Up came into play, we were very well aligned to have the Stepping Up initiative be a part of the bigger strategy around transition from jail to community. And again, I forgive my repetition, but I think this has been critical to our success. It's all focused on long-term public safety.
Great, thank you very much. And Katie, I know, Stepping Up works with all different sizes and types of counties on this, and there's counties who have also built sort of sophisticated systems like this, and then counties that use other kind of systems for keeping track of all of these different components and all of these different pieces that they want to track. Can you talk a little bit about what else you're seeing as far as how, like, sort of the logistics of how people are tracking progress if they don't have a system that's as sophisticated as this? What are some of the ways that other folks are tracking some of these measures?
Yeah, absolutely. I mean, we've been working with counties that are tracking progress through, even through Excel documents and sort of putting in information into there and really using that as kind of a base for tracking who's coming into the system, who isn't. one thing that I'll mention as an example, Franklin County in particular in Ohio had really looked at their system. They were getting a new jail management system for their jail, and had thought through the contract for that, and through some work and being involved in stepping up and their own sort of ingenuity, had thought through their jail management system and sort of what was missing from that. And so they actually worked with the folks who were doing their jail management system, whose name's escaping me. So if they're on the line, would love for them to jump in, or if not, happy to follow up with that. And actually made sure to add to that some additional pieces that could help them get to some of those measures. So for instance, adding in a screening tool so that there would be, they'd be able to screen everybody who came in through, so in essence, it's sort of getting at the universal screening piece. And so I think one of the things to consider is sort of how you can add on to some of your current items that you have, and think through whether or not it's appropriate to add a screen or what have you, just as an example, to then be able to track your progress and to keep track of who's coming in and who's coming out. I will say, like, in terms of other particular systems, you know, I think I'd talk a little bit more about processes, which is something that Mary Ellen talked about as well, just in terms of making sure that there's some really good and established information sharing processes so that the jails know who to connect people to for treatment if they've already been known to the community, and also for the community providers to know if their folks are in jail as well. And so we've had things be as simple as, you know, ensuring that doing some cross-check of information and just having somebody who's actually in charge of proactively doing some of that notification, as long as it's within the boundaries of good information sharing practices and the laws around privacy and all of that. So it's sort of run the gamut between, you know, some good old-fashioned emailing and sort of Excel sheets, to also adding on to systems that are being implemented and making that a priority as well.
Nastasha, if I may add to that, as I'm hearing Katie's response, I don't want to overstate what we have here in Maricopa County, nor am I naive to the fact that we have resources unavailable in the smaller counties. But I want to reiterate the point that much can be done with what you have. For example, we implemented the, forgive me, we're having a call come in. We implemented the proxy, and we've spoke about that before. That's the simple risk assessment tool that we wanted to use to establish baselines. So again, we could measure everything from that point. We don't have a sophisticated JMS system here in Maricopa County. It is very old. It does not easily capture the information that we need. The Sheriff's Office is in the process of updating it. And our classification system, which is where the proxy is administered, they don't have a electronic system in which to enter all of the data that they collect. So what we had to do is simply say, okay, what do we have available? Are there fields there that aren't being used that we can band-aid an approach to put in data that's important to us? We looked at what our reports that were already being generated. Is there something there that we can track? And so we really started with, what do we currently have? How does it tie to what's important to us? Is there capacity in the existing system, however antiquated it is, that we could shift things around? And really, that's what we've done here. And we didn't have a Dr. Cotter until a couple of years ago. So we've moved light years in terms of what our data tells us, but the systems that we have aren't as sophisticated as it may sound like. So forgive my repetition, but it's really important simply to look at what you have, what you're capable of doing with what you have, and start there, because that will help you make the case for what effect you're having, and then clearly identify the deficiencies in your system and help make the case to improve the system to get you better data to measure outcomes.
Great, thank you for that. I think that is also a very important point to make, is look at what data you have right now instead of looking at what data you don't have. Sort of look at where you are now and what you can do to manipulate that and use it in a way that is useful as you continue to expand on the data that you are collecting and the data agreements that you have in place. You know, start with what you have now and go from there. I know that folks can get discouraged, and we want to be able to collect all of these different things, but everybody, like you said, started somewhere. And with some mechanisms. So I think that's a really important point to make, and appreciate that. We had some folks who sent in the questions box, they sent in some of the things that they are tracking, who are folks who are just participants in the webinar. And so I'm going to copy those and put them into the questions box so you guys can see the list rather than me reading off the list, because I know that if I read off the list, everybody's going to ask me to repeat it. So I'm just going to put it in the questions box so you guys can see what these different folks are collecting, because I think it's going to be, really interesting to see what other folks on the phone are collecting as part of that. And, collecting everything from, engagement with care, substance use, homelessness, psychiatric medications, employment, engagement in primary care. And then they're also tracking things like number of officers who trained in CIT, and looking at goals related to reentry, healthcare, insurance, those sort of things. So there's a lot of different data points that folks are looking at that fall sort of under those 4 key measures and are, sort of interim places as well. So I will copy and paste those as soon as I stop talking and send those through the questions box so folks on the phone have them too, because I think that'll be interesting to see. One of the things that I think that one person asked for the Maricopa County folks is if you could quickly talk about how you identify and flag people with mental illnesses who are low risk, and how you sort of pull those out in your system separate from other people who are booked into the jail, or how your system, if your system is set up to have a flag or somehow identify folks who are coming into the jail who have a mental illness, and then delineating those between the risk levels.
Sure. So how they get the flag when you are booked into jail, the CHS database talks to our regional behavioral health authority, and the 2 systems identify whether you are SMI active, meaning you're currently on a case plan, or SMI inactive, meaning you were previously on a case management plan, you're not. And then anyone who needs a further assessment as identified by CHS will get an assessment. After that, you go through a couple different steps. There's 2 risk assessments that we have in Maricopa County. One happens within 24 hours before you end up at IA court. It's called the Public Safety Assessment. It was created by the Laura and John Arnold Foundation, and it ranks individuals as low, moderate, or high. If individuals are detained beyond initial appearance, then individuals go to classification, and classification, as Marilyn said, is where the proxy is administered, and at that point, individuals are classified as low, moderate, or high, and those individuals are going further into the jail system. And so our strategy is to focus our limited treatment resources as identified by the R&R model on individuals who are classified as moderate to high.
So at the point where pretrial services does a risk assessment, the reason we are unable to use that for the entire population is presently that's only done for those under the county jurisdiction. We have an initial appearance court in our jail system for the city of Phoenix, and they are one of our primary contributors to our jail population. They currently are not using a validated risk assessment instrument, nor are all of the justice court detainees having the PSA completed on. So as the prior to the initial appearance, if that risk assessment is done, if there's the SMI flag, we also have individuals from the Regional Behavioral Health Authority in our intake that work with the initial appearance commissioners and pretrial services to help make informed release decisions. Those who do stay, again, if that's when the proxy's done, so then at that point, everyone remaining in the system has that risk assessment. And also because we've had the feed from the Regional Behavioral Health Authority and CHS has done an assessment at that point as well, the information now is merged together and available to both correctional health staff and security staff.
Great, thank you. And I would just follow up to remind folks, or maybe Katie will jump in on this too, but we did a webinar back in, I think it was April, under question 2 of Stepping Up, so conducting timely screening and assessment. And there's some other folks who have done some of these processes as well, and so that might be a good webinar for the person who asked this question to go and review to see, how some other counties, in addition to Maricopa County, are doing some of this work. So I would encourage folks to go look at that. Anything to add, Katie, on that piece before I move on?
No, I think your suggestion as well of listening to the webinar would be another helpful resource.
Great. So I want to switch gears a little bit. We know, and this has been a really good discussion and really helpful, and I think folks are really looking for some of those in the weeds, kind of how we do this kind of piece. And one of the things that I think would be good to talk about too, it's about tracking progress, but it's also about how you share with the right folks to make sure that this data isn't just happening and the only person who looks at it is Ryan or folks on his team, that other folks are looking at it. So can you, maybe we'll start with the Maricopa County folks. Can you talk a little bit about how you approach your county elected officials with your data and your outcomes to get them to sort of understand what's happening or why you're making a certain request to further your efforts? What is sort of their expectation of you, and sort of how are you using and sharing this information with them to help inform some of the asks and the requests that you're making?
I'll start and then turn it over to Ryan. As I mentioned previously, this was really a part of a long-term strategy. When we formed as a committee and framed our initiative around the transition from jail to community, we briefed the board of Supervisors and all key stakeholders at that time. We actually had a informal board meeting held, and we invited community partners to attend. So we laid out the entire strategy. We laid out the risk, needs, responsivity principles. We shared the evidence that existed nationally to support this work. So again, we set a foundation before we even really jumped into the specific work, so they understood and shared a common language. And I think that's critical, that they understand when we're speaking about things like risk needs responsivity and the evidence that they're not hearing it for the first time. Then we do, with the Board of Supervisors, periodic updates on our smart justice efforts and share new programs and initiatives that have been implemented, share the data that shows the trends in terms of jail population and the primary measures that have been mentioned multiple times. With respect to MCJustice, which is our coordinating council, and Smart Justice, we will provide periodic updates. Ryan and his team will share the general trends. So each of those groups have access to the data and the information. With respect to a specific targeted program, then Ryan and his team will prepare specialized reports. They did one specifically on the SMI population in our jails. And that information will be shared with the Smart Justice Committee, the MCJustice Coordinating Council. And it's important to add one piece of information. The chairman of the Board of Supervisors sits on our MCJustice Council. So we have this integrated system that the information sharing is hitting the key decision makers, I believe, at multiple times and in multiple ways. So they are kept informed about our work. So by including them from the beginning, ensuring they had foundational understanding of this work and why it's important, providing them with baseline information about what the current state is. What helped us candidly to get attention is a couple things. One is our budget. Half of our budget, more than half of our budget, supports the justice system. The other issue is we had done a jail master plan, so the board and the stakeholders recognized if we didn't get a handle on our population, we were looking at significant investments in building new jails, and so there was attention paid to cost avoidance that helped engage them in this work and why it was so important. And specifically with Stepping Up, when this initiative was framed by NACO and brought to the attention of counties, we immediately reached out to all of our stakeholders, and the board shared the data that we had already collected on the SMI population in our jails, and then engaged them in signing up the proclamation. And so there's not an easy answer to this question because it's really multifaceted over time, multiple approaches to keeping the issue and the data in front of policy and decision makers. Ryan?
I don't have anything to add.
Great, thank you so much. And Katie, any strategies that that you've seen people using, or that Stepping Up is sort of promoting as good ways to keep county leaders apprised of some of the progress that's happening with the initiative?
Sure. I mean, I think Mary Ellen's response was really comprehensive. What I'll just add is sort of maybe underscoring some of the reasons why utilizing data and this tracking progress piece is really is, we think, helpful when approaching your county elected officials. I think that and county elected officials themselves can speak much better about this, but from our experiences, your elected officials have a lot of decisions to make about many different topic areas, not just the criminal justice space, and are often receiving an overwhelming amount of information and requests for time and funding, et cetera. And I think Stepping Up is really trying to promote, and it's hopeful that being able to provide information that's really distilled into progress against these 4 key measures as a way to maybe demonstrate your success and where some of your needs are is really essential, and kind of can provide a way to present information that is effective and concise. I think, as Mary Ellen rightly pointed out, it's definitely not as simple as that, but we're hoping that being able to utilize some of this and distill it into really concise measures is a way to actually make an approach and justify that you have, you're quantifying your needs, you have real numbers to show impact, as well as real numbers to justify why you may need certain resources to be targeted in a specific way. I'm thinking specifically of that Johnson County example of really utilizing data to demonstrate the need of a full-time position to continue those great outcomes, and the results of that, I think, is a great example of that. So I would just underscore the point that this can help kind of simplify and distill information in a way that helps to demonstrate where you've made progress, where your gaps are, and why you might need or searching for continued support in one area over another.
If I may add one other piece that I think is important, and it goes to leadership, but I want to add access as well. I believe one of the things that enables us to be more effective in Maricopa County, if you were here with Ryan and I right now, you would see we exist in the same space. My office, his, and the research team is in literally the same space. So we have connected, we value research and data and the importance of that. And I walk outside my door and I have immediate access to this information at any time and at all times. So then when I'm engaging in my role as assistant county manager with the board, with the county managers, with key stakeholders, I have the information more often than not, that so I'm able to be immediately responsive when questions come up. I'm able to guide discussions that are associated with these issues because of that, the relationship and the access. So I'm sharing that to the extent possible, though where the data sits, and those who understand what the data is telling us can't be separate and apart from daily operations. You've got to figure out a way that those are intertwined so you're able to capitalize on the data whenever the opportunity presents itself to inform policy and decision making.
Great, thank you. Yes, all very important points to make, and thank you, Mary Ellen, Ryan, Katie, for being on the call today. I appreciate it. That is all the time that we have for questions today for our speakers. If you have questions for the speakers, Mary Ellen and Ryan's information is here, and I'll have Katie's information on later if folks want to contact Katie too. So please feel free to reach out with your questions on those, because I know there's some folks who had questions that we weren't able to get to on here. I'm going to do really quick poll questions and then let you go for today. If we could go ahead and launch the first poll. Great, and we'll launch poll number 2. And if folks who said other, if you just want to put in the questions box, just list what your position is in the county so we have a better idea of who's on the call, that would be great. Thank you. And the next poll, please. Okay, and the next poll? Great, thank you. And for those of you who said unsure, please feel free to check out stepuptogether.org and click on the What You Can Do tab, and you'll be able to see a list of counties that have joined the initiative so you can know if you're part of it. If you think you're supposed to be on it and you're not, please shoot us an email and we'll make sure to add your county to that list. And let's do the final poll here. Great. Thank you, everyone, for indulging me in my polling questions. They really are useful to us, and just wanted to remind you that we will have an evaluation that pops up at the end of this network call, and you'll also get it in your email. We do look at those responses, so we appreciate you taking the time to do that. Just a reminder, the next Stepping Up webinar is going to be on November 9th, addressing housing needs of people with mental illnesses in jails. And then we'll have the follow-up network call, sort of like we did with this one on the 16th. We'll have more of that discussion there. And you can register for all of that at stepuptogether.org/toolkit. So please go ahead and register for those. And thank you again for being part of this network call and part of this initiative. Contact information for the initiative partners is here on the website. Please feel free to reach out at any time with any questions, comments, concerns, ideas. We'd love to hear from you. So have a wonderful rest of your afternoon and a great week.